Hi again, Robin, chronic fatigue expert. I wanted to answer another question that I get a lot and regarding chronic fatigue syndrome is, okay, now I have my diagnosis, what's the treatment? There is no universally recognized treatment for chronic fatigue syndrome. That is because everybody that has it presents differently. We're all unique individuals, so anytime we have a disease or a syndrome, it's going to be unique to our physicality, our hormones. It'll be unique to us. So we may not present with the exact same symptoms across the board. So there's not a consistent treatment plan that doctors follow that everybody gets. The treatment recommendations can vary very widely according to where you are and the doctor's experience with chronic fatigue. There have been numerous studies that do look at treatments for chronic fatigue syndrome, but a lot of them have inconclusive results, meaning it didn't go anywhere. It doesn't show that it's effective versus non-effective. There's no conclusion. And some of the studies have looked at treatment such as graded exercise therapy or mental health type therapies such as cognitive behavioral therapy, and there's looked at lifestyle modifications and pharmacological interventions are probably the most recognized treatment of chronic fatigue syndrome. Due to the depression and the anxiety and the lack of sleep, they would treat those with some type of medication. They're again treating the symptoms, not the syndrome itself. There is very little research that I know of, I'm still looking, that is current. And if it does, I'll bring it to you and we'll discuss it. But new research can emerge over time. I'm not saying it can't, but to my knowledge, there's a little bit right now. So thank you for your time and your attention in watching my video on what's the treatment for chronic fatigue syndrome. If you have any questions, you can always reach out to me at questions@thechronicfatigueexpert.com. I'd be happy to answer them. Have a lovely day.